Nursing shortages and high turnover rates are common in hospitals across the United States. This presentation will examine a potential solution to this problem on an oncology unit in Flint, Michigan. Elements of this quality improvement project to be discussed will include a mission and vision statement, a strength, weakness, opportunity, and threat analysis, an aim statement, and methods of stakeholder engagement. The oncology unit faces several challenges. First, there are staffing shortages on night shift. Overall, there is a shortage of experienced registered nurses, especially on night shift. There is poor employee retention, as experienced employees tend to leave for other positions. This is a common phenomenon nationwide. While the average employee turnover rate for all industries is around 15%, healthcare workers have a turnover rate of 20% or higher. Retaining RNs is one of the most important ways to prevent RN vacancy. The mission statement is as follows: to build and retain a staff of high quality, highly satisfied registered nurses to better serve the oncology population. Note that the focus is not just on building a quality team, but also retaining one. There are many different methods for retaining employees. The vision statement reads, the oncology unit will deliver excellent care with a staff of highly satisfied expert nurses. Again, note the team is made up not just of expert nurses, but highly satisfied expert nurses. Maintaining staff satisfaction and prevention of burnout is extremely important for the nursing profession. A SWOT, or Strength, Weakness, Opportunity, and Threat analysis, will be performed to evaluate the current climate of the oncology unit. First, there is a tight-knit core of experienced nurses on day shift. This is a strength. The unit has a dedicated nurse educator who can focus solely on the needs of the oncology unit. Finally, the hospital offers relatively high pay compared to other acute care settings in the area, which attracts staff. These three factors would seem to be an excellent way of attracting and retaining staff, but there are several weaknesses to consider. The staff consists mostly of inexperienced nurses on afternoon and night shifts. There is a high turnover rate. There is a high rate of staff dissatisfaction. CNA shortage creates additional work for nurses. Finally, shortages cause frequent mandatory overtime. All of these things can contribute to burnout and RN vacancy. There are several opportunities to be considered. First, a nurse leader could implement interventions to improve staff morale. This may include simple things such as acknowledgement and praise of employees. The nurse educator can educate new nurses to create a group of expert oncology nurses. The emotional climate should be examined and modified to create an environment that fosters RN and CNA retention. Finally, classes should be provided on stress management and burnout. There are threats to the ongoing success of the oncology unit. First, experienced nurses may leave for other positions or retire. Second, high acuity and increased patient census creates additional stress for nurses, as environments of high stress can cause experienced nurses to vacate their positions, and knowledge of the work environment can frighten away potential new nurses. To decrease RN turnover and burnout, by December 2018, all RNs will attend a class on burnout, stress management, and compassion fatigue. Nursing leadership will implement a policy of praise, encouragement, and acknowledgement. As a result, turnover rate will be less than 15%. There are many different interventions that a nurse leader could implement to attempt to solve issues on this unit. However, rather than becoming paralyzed by choices, it is best to attempt a few interventions and see how they work. The stakeholders in this situation are the RNs. They will be engaged through classes and through positive encouragement and acknowledgement. An effective way to accomplish these goals is by use of servant leadership. Putting the needs of the RNs first and serving them by meeting their needs will help to solve problems the unit faces. RN vacancy is a problem nationwide. For the oncology unit discussed in this presentation, creating an environment of positivity and educating staff on stress management and burnout prevention can help to solve this problem.